Hello, I'm Dr. David Hawkins. I'm the director of the Marriage Recovery Center, and I want to follow up on our conversation about narcissists. So, I don't have to tell you that this topic has gathered a lot of interest, and people are really looking for accurate information about narcissism. Well, there's a couple of problems here. First of all, you go to the textbooks, and I've been a psychologist for over 30 years, and you read about narcissistic personality disorder, and oh my goodness, the information that you can get is just brutal. It just says, the NPD is untreatable. There's nothing you can do. Run. Get out of the relationship now. Don't stick around. You're going to get hurt. You're going to get hurt very badly. Well, of course, some of those stories are true, but there's also something else to be said about this. Now, I've said in other videos that we really need to look at NPD on a spectrum, just like ADHD, just like depression, just like anxiety, like any other disorder or emotional problem. There's a spectrum, there's a continuum. So it's not like either you are a narcissist or you aren't a narcissist. Please understand that. It's a spectrum. There are people that have some narcissistic tendencies, moderate narcissistic tendencies, and some that have serious and extensive narcissistic problems. But I'm going to take a contrarian point of view, and I would like you to test this out. I want you to work with me and consider these possibilities. So again, first of all, NPD is on a spectrum. Please understand that. There's narcissistic traits. And those are the people I really want to talk to. I want to talk to those of you that are involved with someone with narcissistic traits, tendencies. They have some issues with entitlement. They have some issues with lack of empathy. They have some issues with grandiosity. They have some issues with very thin-skinned emotions. That all of those patterns fit this individual that you're talking with and that you're in relationship with. Now again, my colleagues are going to tell you to run, get out, it's dangerous, run. I want to tell you something very different. I want to give you 2 points here. And the main point of this video is couples counseling for narcissists. Some of my colleagues are going to scream and just say, Dr. Hawkins, you are off your rocker. You don't know what you're talking about. Well, actually, I do know what I'm talking about. Having treated nearly 2,000 couples at the Marriage Recovery Center, I have seen incredible results with couples counseling for narcissists. Now again, please remember, spectrum. Please remember that you can have mild, moderate, severe. Okay, that's one of my main points. The second point is any problem will persist without intervention. Once again, any problem will persist without intervention, whether that's a medical problem, a dental problem, a spiritual problem, or an emotional problem. It will persist without intervention. Now, the good news, of course, is with intervention, people can change. Who wants to be told you can't change? You've got NPD. I've got to run from you. You're sick. You're troubled. I can't be with you. Well, wait a minute. Will you please consider a couple of things? Without any intervention, a problem will persist. With intervention, a problem can be interrupted. What does intervention look like? It looks like you saying to this individual, I'm happy to be in a relationship with you. I care about you. I love you. And by the way, that's why we don't just run, because our lives are commingled with these people. We care about them. We love the good sides of them. We hate the bad side. All right. An intervention says, I want to be with you. I want to be in a relationship with you, but I will only be in a relationship with you if we embark on a journey of change. Now, Okay, intervention, the opposite of enabling. Enabling means sitting back and doing nothing or just complaining and arguing and trying to wrestle change out of this individual. That's not going to work. It will not work. So intervention is a decisive action taken that stops a destructive process. What are some ways of intervention? Again, it means looking at the individual and saying, I will only be involved with you if we embark on a journey of change. What's the journey of change? Here's what I've found with 2,000 couples, many of them with narcissistic issues. The journey of change means you will participate with me in both individual and couples counseling. Yes, couples counseling, intensive couples counseling, not 1 hour a week. Please don't do that. Please, please, please don't go for 45 minutes once a week. You will end up dropping out after 6 weeks. You'll be so discouraged and so frustrated. But work with someone like myself who is willing to sit with you for 3 hours at a time, maybe doing marriage intensives like I do with 3 hours at a time over 3 days, 3 hours at a time, twice a day over 3 days, 4 days, and then you will start to see some change. Now, in that couples counseling, I'm going to look at that person's ability or inability to empathize, and I will teach them and cultivate this skill of empathizing and caring for what their mate thinks and feels. I will confront their grandiosity, their hard-headedness, their tendency to bulldoze their other mate. I will confront that very decisively. And you, who are the partners of the grandiose, entitled, thin-skinned, narcissistic man or woman, you will set boundaries. Boundaries, important word. You will say, I will no longer tolerate this behavior. And then don't tolerate it. It may mean an emotional separation of 1 hour. It may mean an emotional separation of 3 days. It may mean a physical separation of a week. But you're going to say to him or her, you must participate in this journey of change called an intervention. And I will walk you through the steps of how this works. And then in that process, we will work on empathy. We'll work on the ability to validate and see the point of view of the other and manage one's own reactions. The narcissist has trouble with that, holding on to their own reaction, their own feelings, learning how to identify their feelings, holding on to them while they attend and attune and attach to their mate. All right, so there is much work to be done, but much work can be done. I really want to challenge you. Get a hold of me. My name is Dr. David Hawkins. I'm the director of the Marriage Recovery Center. You can email me at drdavid@marriagerecoverycenter.com. You can call me 360-490-5446. Narcissists really can change with intervention, individual couples counseling, and I want to hear from you. So again, people won't change if there isn't intervention. People will often change when there is. And that can be good news. Your relationship really can be healed. Okay, Dr. David Hawkins, Marriage Recovery Center. I really hope I hear from you. All right, take care.